Hey there, it's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Now, what we can talk about today, a lot of people don't know, but one of our practices here is neuropathy or core health, okay? And obviously, it's not chiropractic, it's not a neuropathy treatment. So to that end, I want to go over what happens when you wait, the longer you wait for getting help, this delay, what happens? First thing I'm going to go over is symptoms usually creep forward, okay? They don't really go away. Maybe in the beginning, if you're taking gabapentin, Lyrica, or Cymbalta, you see a change. But what happens in a sense there is you're kind of dumbing down a nerve that's kind of under siege, as it is to say the least, if not getting destroyed completely. So when you have the symptoms creep forward, you're going to see more numbness, more burning, more pins and needles, and sensitivity changes over time. Now, the problem with sensitivity changes over time, it's really hard to judge. And when you're less sensitive, it becomes more of a problem. And, without getting too worried, but, I've had people who fell asleep with their feet near a fire, their foot burned. Now, that's just itself, well, it's pretty serious if you think about it, because they can't feel their foot. And they're already having problems with gait control, walking as it is. So a burn of the foot's a pretty serious thing. Next thing you got to watch out for, too, is your sleep gets hammered. Neuropathy will commonly disrupt your sleep. And that's going to make the pain perception worse during the next day. So, I'm not making this stuff. This is a common occurrence. You have a hard time getting your sleep. A lot of times people wake up and they feel like they have bugs crawling on their legs, all kinds of horrific stuff like that, or pain. Just wakes them up in the middle of the night. That burning sensation just gets worse and worse. So that's something you have to be concerned with the longer you delay. Now, if you're happy taking, like I said, Lyrica, Cymbalta, and gabapentin, well, you don't need to listen to this. But if you do have neuropathy and you're not happy with what's going on, I'd encourage you to stick around and listen. It's not a long podcast we're doing today. Now, as the longer you wait, something you're hard to see until it happens, your fall risk rises incredibly because your balance confidence just drops. You do not have the same balance. Now, if you want, reach out to me. You can call the office 203-656-3636, 203-656-3636. Leave your email address, name, number, and I'm happy to send you the home exercise program that I have that will help your balance. You do not want to lose balance. You do not want to fall. A broken hip doesn't do anybody any good. And quite honestly, a lot of times they lead to extended stays in nursing home. All right, so please be careful with that. You don't notice your balance going down south, you're in trouble. You're in a danger zone. So what happens too is you have a loss of sensation and vibration sense. When this happens, the near falls, the increased falls, especially in older adults, skyrockets. I mean, it's bad enough if you don't have neuropathy. It's really bad when you do have neuropathy. So please reach out to me. Send for my free home exercise protocol. And it takes about 8 to 10 minutes a day. Really, if there's anything you get out of today, reach out to me. All right. Another thing, too, is foot problems can snowball, especially with diabetic neuropathy. One thing I recommend is people actually inspect their feet every day because unnoticed injuries and ulcers lead to infection. And that's the worst thing here is there's a higher chance of amputation if things progress. And I'm telling you, they will progress. They creep forward, the symptoms associated with neuropathy. But that means the nerve is not telling the brain what it needs to do. So it's sad to say, but daily function and quality of life tends to shrivel. You got advanced neuropathy, you got to start, people tell me it's limited walking, standing. You basically start to hang out on that couch a little more than you need to hang out on that couch. You're not getting up, especially with the balance in. So what we see happen is mood and anxiety often worsen. Okay, that's pretty serious because the cerebellum, which is that little bulb at the back of your head, that deals with balance amongst other things. Actually, all sensory input into the body. you start to see somebody's mood goes sour and much often increased anxiety. Now, these are also things that are very similar to dementia and Alzheimer's. Now, and I'm not lumping Alzheimer's in with neuropathy. You're better off getting neuropathy under control now while you have the chance, because all these things, you remember all the stuff, all the talk about, COVID, is the comorbidities. Comorbidities is, okay, you may have had diabetes, and that's why you have neuropathy. You may have had chemotherapy, and that's why you have neuropathy. You may drink too much alcohol, and that's why you have neuropathy. But all those things are comorbidities, then they start adding up. It's one comorbidity is bad, 2, 3 much worse, and your outlook is not going to be what it needs to be in order to stay healthy and enjoy life. So what happens here is also too is people rely on pain medications without addressing nerve function. Like I was saying, the gabapentin, pregabalin, duloxetine, they may help for pain with some of you with neuropathy, but the results vary and they don't restore nerve function. That's the thing here. And then another thing too, I'm going to tell you, if you are taking these medications, do not stop taking them without consulting the doctor who prescribed them. I'm not here to tell you get off any medication. That's wrong. I'm not going to do that. Go talk to your doctor. Maybe they have alternatives for you. Okay. We touched on the thing about, foot problems, which can snowball a little bit more with neuropathy from diabetes. But hidden injuries are easier to miss. Okay. Reduced sensation means burns, cuts, and shoe-related wounds will often go unnoticed. Check your feet on a daily basis. Now, if you can't check the bottom of your foot, have a loved one, or if you have an aide or someone, a nurse coming in, make it a point. Now, another thing too is, let's take it one step further with this as far as the feet. If you do have neuropathy and it's been going on for some time, I would suggest you go get a visit with the podiatrist. Take care of your feet. You only got 2 of them, and you need both of them to keep you standing upright. So when you have the thing, you can't see these injuries. It's really devastating. Now here, let's go over the longer you wait, the murkier the baseline is. With early testing, it's a lot easier to see what's changing and what's helping over time. Be proactive. It'll help you prevent or delay damage, which is really, really important. That's not coming from me. That's coming from the American Diabetes Association. So there's a lot of stuff that you could be doing to make a difference with it. Delaying care, delaying a diagnosis. I mean, you may have a diagnosis, but that's it. Okay, you just pop the pills. Not a good idea. I think I've outlined enough action steps that you can take now on your own to minimize the effect of peripheral neuropathy, because it will get worse. It does not get any better. Unfortunately, it will get worse. And then those, like I said earlier, those comorbidities start to add up. So please protect yourself. And again, reach out. Do my home exercise program. I'm not asking for anything here. I'm not selling you anything. Call the office, 203-656-3636. Tell them you would like it. I don't care where you live. I'm more than happy to send it to you. You go do these exercises that can help with your balance. And you need to do them every single day if you want to ward off the balance issues. Okay? I'm Dr. Brian McKay, Neuropathy of Core Health, as I'm speaking about today. And I am not just a chiropractor. I'm not a bad guy either. At least my mother doesn't think so. All right. I hope you learned something. And don't forget, if you have trouble, call and ask for my free home exercise protocol. Thank you very much. Have a great day.